Welcome to CPT Coding Guidelines Review, Tissue Flaps and Grafts. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in your ability to code these procedures. The guidelines are waiting, so let's get started. Knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guidelines Review covers the guidelines for coding tissue, flap, and graft procedures. So before we dive into the guidelines themselves, let's take a quick look at what tissue flaps and grafts are. Tissue flaps and grafts are used to close wounds that require reconstruction because they are too complex to close primarily, such as with sutures or staples. Both grafts and flaps require the movement of tissue from one side on the body to the site of the wound. Grafts are thin sections of tissue that are cut free from the donor site and do not have their own blood supply. Flaps are blocks of tissue that include a blood supply. These may be developed and moved to the wound with blood flow retained from the donor site, or they may be dissected free of the donor site, which requires anastomosis of blood vessels at the recipient site. If you'd like more detailed information about flaps and grafts, the reference shown here is a good option for an expanded overview of these procedures. Codes 15570 to 15738 report skin or deep tissue flap procedures. For these procedures, the region listed in the code descriptor refers to the recipient site when a flap is being attached in a transfer or to a final site. The region listed in the code descriptor references the donor site when a tube is being formed for later transfer or when a delay of flap occurs prior to transfer. This distinction is important because although the same codes are being used, selection of the correct code based on region is determined by what is happening to the flap or tube during a particular operative episode. Codes 15733 to 15738 report muscle, myocutaneous, or fasciocutaneous flap procedures. These codes are assigned based on the donor site of the flap. Code 15740 reports an island pedicle flap, requiring incorporation of an anatomically named vessel into its design, because remember, flaps have their own blood supply. These are cutaneous flaps that are moved into a defect that is near but not immediately adjacent to the donor site. The flap is typically tunneled under the skin to its new location and then sutured in place. The donor site is closed directly, and closure is not reported separately unless it requires skin graft or local flap. Code 15750 reports a neurovascular pedicle flap. These flaps include not only skin, but also a sensory or functional motor nerve. This allows the flap to be used to reinnervate a damaged portion of the body dependent on touch or movement, such as the thumb. Direct closure of the donor site is not reported separately. Closure of the donor site that requires skin grafts or local flaps should be reported as an additional procedure. Codes from the range of 14000 to 14302 are used to report flaps without clearly defined anatomically named axial vessels, such as random island flaps, VY subcutaneous flaps, advancement flaps, and other flaps from adjacent areas. Code 15769 is used to report grafts of autologous soft tissue, including fat, dermis, fascia, or other types of soft tissue. To report these codes, the tissue must be harvested from the patient using an excisional technique with placement into a surgical defect during the same operative episode. Autologous grafts that are already defined in CPT, including skin, bone, nerve, tendon, fascia lata, or vessels, should be reported with the specific codes for each type of tissue. Codes 15771 to 15774 report autologous fat grafting that meets the following criteria. The cells are harvested via liposuction, prepared with minimal manipulation, injected via cannula, and injected in multiple small aliquots. The regions in these codes refer to the recipient area of the graft, not the donor site. For multiple sites of injection, sum the total volume of injection for sites grouped together in the same code descriptor. Codes for subcutaneous injection of filling material 11950 to 11954 should not be reported with these codes for the same anatomic site. Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review series, as well as our full catalog of courses at hialearn.com.